This is going to be a quick video overview of how to do the Elluminate protocol with proper technique. The Elluminate protocol is using 4 different wavelengths, as you know. We're going to be working in order of depth of penetration as far as the wavelengths go. So with that being said, we will walk you through the different steps, but they contribute 4 different wavelengths to the Elluminate procedure. The first step will be adding a 1064 YAG to stimulate and heat up collagen. The second step will be doing a 755 nanometer alexandrite, which will be responsible for targeting pigmented lesions. And then our 532 KTP laser, which will be responsible for treating those superficial facial telangiectasia. When we're finished with those 3 steps, we will end it with a 2940 erbium. And if you have a Tetra Cool Peel, you can use that as well. So this is an overview of what the treatment is going to be in different steps. As you can see, first step will be starting at the bottom, second, third, fourth. This is a before and after one treatment so that you could see the improvement in tone and texture, as well as diffuse pigmented lesions and little broken capillaries that she has on her cheek and chin and forehead, and then a smoother texture as far as her pore size. Starting with step 1, there is a conservative settings and there are advanced settings. The first settings are going to reflect the conservative settings, which are going to give you only 1 pass to do at a longer pulse duration. The aggressive settings are going to be set at a shorter pulse duration, but allows you to go over and over as many passes as it takes to get clinical endpoint. This is the advanced setting where you're doing a painting technique and you can do 4 to 6 passes. Your clinical endpoint is mild erythema. Now that we've finished the first step about doing our YAG, we are going to be using the 755 to target brown, benign, pigmented lesions as you see here in this graphic. So we are going to treat either the whole face if they have diffuse pigment, or we can spot treat if there's significant, just a few brown spots present. But by going to that larger spot size and doing a 10 to 20% overlap on the full face with your 755 will give you that clearance of pigment and reds. Let's watch a video and see our technique. As you can see here, we are globally treating the patient's full face to hit all of her diffuse pigment. So we are using our 10 millimeter spot size, covering the full face, again overlap 10 to 20%. Our clinical endpoint is going to be darkening of the pigmented lesion and a little bit of erythema around the lesion. At certain points, you'll see me using the cooling end of the laser to pull some of the heat out of the skin after I've pulsed. You don't want to pre-chill the skin, just post-cool to pull the heat out.
Okay, feel heat? Yeah.
That's the clinical endpoint you're looking for, the pigment starting to get a little darker. Sometimes I stagger the spots diagonally so that we prevent buildup of heat if we just go one after another in a larger area. So it may look like I'm zigzagging, that's intentional. Now that we've finished with the second step by using the 755 to go after the pigment, our next step is to use our 532 wavelength, and that's to go after our vascular components with the 532. So you see here, now that we're able to target those superficial vascularities that lead to diffuse redness and superficial telangiectasia. So we're able to coagulate those, and that's just going to be a spot treatment. We do not need to do this full face, just in the field or the area that the benign vascular lesions may lie. Here we're using the 532 to treat a little telangiectasia in the crease of the nose. After I pulse, I immediately use the cooling plate on that distance gauge or a delivery system to cool off the area. So this one can be a little bit more zappy. You could see I have our vessel lined up. Immediately I'm putting that cool right on to pull the heat out of the skin so that we can prevent any issues on the surface of the skin with that energy. So as you see here, this is just spot treating where our patient has specific vessels needed. Our last and final step with the Elluminate is going to be step 4 with the 2940, which is our fractionated erbium YAG, meaning that we are delivering fractionated microbeams of energy versus the full spot size. So this is a way to give someone a little less downtime. You could do this full face if somebody has specific needs above the lips or in the eyes that they want a little bit more depth, then you could focus on those separately with full beam. But with the Elluminate, we're just giving a nice superficial exfoliation, resurfacing treatment to make the appearance of fine lines and pores appear more smooth. As you can see here, there's minimal overlap, maybe 10%. Every once in a while I do a damp gauze just to kind of give the patient some comfort, reposition myself, and move to the next section. My technique here is bunny hops. I do individual pulsing. I control it with my foot pedal. You could see on this patient's right upper cheek how nice her pigment pulled from our 755. That's a great clinical endpoint that we're about to go right over with our erbium.